Hello and welcome to our special interview session. I'm Steve, I'm a clinical educator and pharmacist at Town & Country Compounding, and today I'm joined by Viral, our esteemed Director of Pharmacy Operations, and we're here to discuss an important topic, which is ketamine clinics. They are popping up across the nation, and there's a problem with ensuring proper supply, but even more importantly, proper quality. So first of all, Viral, thank you for joining us. Really appreciate it.
Thank you for having me, Steve. Pleasure to talk about all of the shortages and challenges our ketamine prescribers are facing and how Town & Country can help.
Yep. A little bit of karma here because this is my boss, so he's usually used to interviewing me. Now I'm interviewing you. Karma. Anyway, so let's dive right in. Viral, can you tell us about the challenges ketamine clinics face, particularly with the shortages?
Absolutely, Steve. So ketamine clinics have been faced with a lot of challenges during the commercial product being on shortage. Mm-hmm. And one of the things that we do here at Town & Country, we have a state-of-the-art USP compliant clean room where we can compound this in different strengths and also in a preservative-free option that we can provide to our prescribers. But also, besides the injectable, there's also the other forms that we can compound, especially if prescribers want to try different methods of delivery. One of the things that we try to do here, especially with all of the regulations changing, we're trying to stay up to date, if not ahead of the curve, and making sure we're following best practices, not just what you should and should not do, but going one step further and doing the utmost best practice in all of our labs. And I know a lot of the other companies, with the changes, there's a lot to adapt to. But we got ahead of it. We moved locations and built a state-of-the-art facility from scratch because we knew the regulations were going to change and everything was going to get stricter.
Ketamine clinic perspective, why should they partner with us compared to some of the other pharmacies? I know we have a new portal, which is really nice to use, especially if you're at a clinic. Can you elaborate on that?
We pride ourselves on our quality. We test all of our batches, especially the ones that we're sending to these clinics because of the nature of ketamine. We send all of our batches for testing for sterility and for potency and to make sure we're delivering the high quality product. We will not release a batch unless it's approved by our analytical lab, and there's not everyone does that, and to each their own, but we want to make sure we're helping our patients and helping our prescribers rather than trying to focus on volume.